this is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be discussing serratus anterior muscle mobilization as well as stretch video. Anytime that we use our serratus anterior, which is during reaching, the top of a push-up, or even a punch, we might even be specifically strengthening this exercise to rehabilitate our shoulder. We can get a bound down serratus that starts to get restricted, decreases rib expansion, decreases trunk rotation, or creates a human movement diagnosis of asymmetrical trunk rotation, particularly with arm movement. This can be one of the true causes of the unequal rotation into your trunk, thorax, or thoracic spine. By standing tall and having a neutral spine, tilt pelvis, tuck navel to spine, can you externally rotate and swing your arm and trunk to rotate the trunk? Do you feel a difference from left to right, or does one side pull your body further into rotation than the other? This can help you identify which serratus anterior may be in fault. If you palpate between your chest and your lat muscle, inside the armpit and down the ribs, you can often feel a very tender muscle that you press on. This is the serratus anterior. I can mobilize it with my fingers, with fiber, side to side, cross fiber, up and down. This is known to be exquisitely tender, and in some so painful they can't take it. So starting with your fingers for more control and or a softer mobility tool is ideal. I can also release it with movement, so I can engage my back scapular muscles and start to free up the serratus. The thought just came to mind. Any swinging sport, like a racket sport or golf or baseball, this should be checked from right to left for any restrictions, asymmetries, and or weakness. For more aggressive mobilization, we can bring this to the ground or table. Here I'm using a large self-care mobility tool, going just lateral or to the side of the pec major and medial just inside latissimus dorsi. Again, I'm starting in the axilla, or what the layman might call the armpit. Here I'm searching for the tender spots on the rib cage, which is my serratus anterior. If you're unsure, you can push into the ground to protract the scapulae to engage the serratus to know that you're on the right muscle. I highly recommend starting light, starting with the less aggressive tool, progress to more pressure and a more aggressive tool. I can roll, I can tack, twist, I can shear with fiber, cross fiber. I can contract by protracting and then relax by retracting. Multi-angle release is critical for multi-angle function. We don't move like robots, we move like humans. Next, you can do a stretch mobilization where you hook the arm around a chair or something stable. I'm rotating my trunk away. If I'm treating the left, I'm rotating to the right. Here I can take several deep breaths as I mobilize and stretch the serratus anterior. Now, this is a commonly weak muscle that usually does not need stretched, but in the patient that has trigger points and or tightness from overstrengthening it, this could be effective at releasing flank pain, rib pain, and or thoracic pain. The serratus anterior can cause pain all along the side and even at the bottom inner tip of the scapulae, or what we call the interscapular region. If you have those pains that are produced with palpation of the serratus, there is a good chance you have human movement diagnosis of serratus anterior hypomobility. If the muscle's unable to move freely from the bone, it can become restricted, and restrictions are known as hypo. Hypomobility of a muscle is the definition of how the muscle moves from the bone or amongst other structures that it lives by. A good starting dose is 3 to 5 minutes. Expect it to be sore for a couple days. You can give it a break for a few days and then return until it's no longer tender or sore, and or you feel that you can do better trunk rotation, especially as you rotate the shoulder out to the side and overhead. If you've liked our serratus anterior muscle mobilization video, please hit the like button, the subscribe button, and please share this with your friends, family, and colleagues. Take care and see you all again soon.